Incontinence is an incredibly complex topic. I could literally dedicate an entire YouTube channel just on incontinence, but there are three main types. Okay, so there's stress incontinence, the kind where you are not stressed out, but cause physical stress to the bladder, and it causes it to leak, coughing, sneezing, dancing, things such as that. The second type is urge incontinence, where the muscle of the bladder is physically overactive. And then the third type is a little bit more of a more complex type. It's called overflow incontinence, where the bladder gets hyper distended and the pressure's built up so much that it just kind of leaks out. Okay, and the first step in management is always to try and figure out which type of continence the patient has. And sometimes it's one of those, sometimes it's a combination of all two or three of those. So, really that's the first step in management, and then we go from there. What are some treatments? Well, the treatments are largely dependent on what type of incontinence the patient has. Treatments vary from simple medication to pelvic floor physical therapy to relieve the pelvic floor from the pressure that's built up, or to build up the pelvic floor to strengthen it and hold back the urine, depending on what they have. There's so many advances in precision treatment offered in urology today. In incontinence, the options are so many, and it really does depend on what the initial problem is. For overactive bladder, there's advanced therapeutic options. For example, if medications fail, like we can put Botox directly into the bladder. And for both underactive and overactive bladder, I can actually place a pacemaker into the spine, and that actually helps to regulate the contractions of the bladder. The important thing to do is to talk to the patient and figure out what the best option is for them.